Just okay. And you don't have any video? No? Okay, okay, okay. You can come.
शैलेश भाई।
Yes, yes. Yeah.
तो
Okay.
सर आपको कर दिया, लिंक भी भेज दिया।
Yes, 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 yes,
ओके सर,
yes, yes.
टेक केयर, बाय।
Thank you, thank you. We'll wait for another 2 minutes, then we'll start. Uh, Okay, I welcome Dr. Swaleha and Dr. Varun. They are today's moderator, and Dr. Dipti is presenting. Madam, you can introduce yourself, Swaleha Madam and Dr. Varun, and followed by Dipti. Then we can start.
Yeah,
Please go ahead.
I'm Dr. Saleh Nadaf. I'm Associate Professor at Department of Neurology in Iron Hospital.
Yeah, Mr. Varun.
Hello, am I audible?
Yeah, yes, yes.
Yeah, I'm Dr. Varun Vadataria, Assistant Professor in Neurology, Sumandi Vidyapit.
Okay. Okay, Dr. Dipti, you can introduce yourself, then you can start.
Myself, Deepthi, final year resident from Lalita Super Specialty, Guntur, sir.
Yeah, go ahead.
My patient is 65 years female, I Sumati, studied till 3rd class, resident of Jonnagadda, homemaker by occupation. Informant her husband and son came with chief complaints of memory disturbances from 1.5 years. Coming to her premorbid functional status, wakes up by 5 a.m., completes daily rituals, goes to milkman, which is half a kilometer away from her house, brings the milk, then cleans the house and prepares breakfast for her and her husband. 1 minute, sir. By 8 a.m., takes bath and gets ready, offers prayers, then takes short nap for about 1 hour and again starts cooking and finishes the lunch by 12 noon. Cleans the utensils, goes to temple daily in the evening, watches the serial daily from 6 to 9 p.m., prepares the dinner along the side, has and goes to sleep by 9 p.m. If she needs any groceries, she goes herself to nearby shop and brings whatever she needs. This is her premorbid status. Coming to history of presenting illness, my patient is being in this premorbid condition. Attendance noted the following complaints from 1.5 years. While cooking food, if she is doing two tasks simultaneously, like cutting and cooking, or while talking on the phone along with cooking, she forgets to off the stove. But according to attendance, she cooks appropriate amount of the food and it is tasty. Places the clothes in the washing machine. After finishing the washing mode, she has to change it to the drying mode. But she started forgetting it. Initially, husband used to remind her. She, even though he reminds her, after going there, instead of changing it to dry mode, sometimes she keeps on again in the washing mode. Sometimes she tells that even though I am switching on the button, the machine is not operating and says it's not working. She used to go daily to the temple but from the past 1 year, going to the temple only during festivals. Started misplacing the objects and searches for them in some other place. If unable to find them, she becomes aggressive. From the past 1 month, uh, when she is unable to find those objects, she started blaming her daughter-in-law and grandchild that they had stolen them and start scolding them and asks them to never enter into her house. Forgetting to take the tablets as per schedule, now her husband is giving the tablets. So, she asked her husband, "Where did you go?" in spite of informing her. Recently, she started asking who are residing in the first floor. That actually she knows that her daughter-in-law and grandchild are residing, but from 1 month she started asking who are residing in the first floor. When the husband tells our daughter-in-law and grandchild are residing, she tells, "Oh, okay." Able to bring the household groceries from the shop, but unable to get the information regarding the financial matters because the husband gives the exact amount from the starting time onwards. He used to give the exact amount for the milkman or monthly groceries. He used to give the exact amount he is telling. Socializes with the family members normally, and whoever comes to the home greets them and offers coffee or tea. Able to follow the serials.
Yeah,
She doesn't
okay.
require any motivation to.
Swaleha madam, can we go slide by
Yeah,
slide?
we'll go back to the
Confirm.
first slide. We go back to the first slide.
Okay, ma'am. While cooking food, if she is
No,
doing
first
two
slide,
tasks,
first slide.
premorbid functional status,
Before that, have you written, what have you written?
chief complaints,
Okay, okay. Only this is the chief complaint, behavior, forgetfulness or memory issues.
forgetfulness, and
There are
some
no
anger
behavioral
issues.
issues in this.
Yes.
Okay. And then next slide.
Premorbid functional status, ma'am.
Mm-hmm.
Wakes up by 5 a.m., completes daily
Yeah,
rituals,
this is
goes
fine. Then we go to the history of present illness. Yeah.
while cooking food, if she is doing two tasks simultaneously, like cutting and cooking, or while talking on the phone along cooking, she forgets to off the stove.
What
Her
does this
hus-
mean? What does this complaint mean?
uh, One is divided attention or some episodic memory problem she is having.
Why would you call this as a episodic memory issue? Because when you're doing some activity and at that time you have forgotten to do something, is that an episodic
If she is
memory?
talking for longer time on the phone, she might forget because the duration we don't know while talking the phone. That's why I kept episodic as well, ma'am.
No,
Or
but
else
she's
while
currently not finished the cooking, right?
yes, yes,
She's
ma'am.
doing it and then she's forgetting also.
Yes, ma'am.
So it's not like she finished the cooking and she forgot to, even if that complaint is there, usually
Mm,
forgetting to switch off the stove is not an episodic complaint. It's actually a more of working memory complaint. Attention or working
yes, ma'am.
memory.
Yes, ma'am.
Okay, even like switching off the geyser. They have taken bath and they forgot to switch off the geyser.
Okay, ma'am.
That also comes under you're doing an ongoing activity and along with that you have forgotten it.
Okay, ma'am.
Okay, so what is the definition of working memory?
Temporarily holding the information and manipulating till it is used.
Okay. So that is what, no? So she's continuously holding an information of cooking or some
Yes, ma'am.
activity of cooking and she has to do certain steps.
Yes,
Okay.
ma'am.
But then while doing it only she is forgetting to switch it off. So it is like a working memory.
Attention. Divine.
Okay.
Okay, ma'am.
Only this is the history in the cooking part. The whole process of cutting and mixing
Cutting
the
everything, proportion of
ingredients, the
ingredients, salt, and
steps. Yeah.
those are correctly only she is doing. Previously,
Um,
how they used to be tasty, now also they are in the same way. Her husband is telling, ma'am.
Okay.
I would like to know, like, if she does only one task, whether she's doing it finely or like she's having complaints while doing two tasks simultaneously.
Her
If she's
husband
cooking and
noted
not
only
doing
while
like
doing
routine,
only two tasks, he told, sir.
so that is like prominent attention impairment and like something called
Okay.
executive dysfunction. Task switching is there and dual tasking is there. Like during that only
Okay,
she
sir.
is having difficulty, I guess.
Yeah.
Okay, sir.
Is she able to choose the
Ingredients,
small, yeah,
what
whether they are kept in or somebody
ingredients
has to
herself she. No,
uh,
ma'am. Only husband and wife are residing. In the above state, daughter-in-law and son will reside. But
hmm.
she is only cooking ingredients, everything. She herself brings and she herself cuts
Have they
and she
labeled them?
prepares her.
Have they labeled them like salt, sugar, all those things are labeled bins they have or they,
I didn't ask that question, ma'am. But uh,
yeah, because we need to know that part also.
yes, ma'am. Okay, ma'am.
Okay.
She is
Sometimes they have
uneducated, third
difficulty,
class.
sometimes they mix sometimes they can make a misjudgment of it. Okay, so they
Okay.
may choose a sugar instead of salt because it looks same. So it will give some additional information. Okay.
Okay, ma'am.
Hmm.
She's third class. Reading and writing, she doesn't know, she told, ma'am. That's why. So I thought
Hmm.
it's less likely. Even if we return, she don't know.
Hmm. Okay. Then.
Places the clothes in the washing machine. After finishing the washing mode, she has to change it to the dry mode, ma'am. But she started forgetting it. Uh, when the husband notices, he reminds her. Even if he reminds, uh, till while going to the by the time she reaches the washing machine, again she forgets to shift sh- change the washing mode to drying mode. She keeps on in the same washing mode, or else sometimes she switches the
What is
button
this?
and
What does this entire complaint mean?
working memory in it.
Can there be other interpretation of this? What you're telling is that she has to
Executive
one part she does, and then she has to follow with the next step which she doesn't do.
yes, ma'am.
Okay. So what does that mean?
Executive
There are
function.
many, at least 2 to 3 interpretations of this
Yes,
complaint.
ma'am. Yes.
Hmm.
Might be one working memory, other is executive function, the other is semantic memory using the instruments. She
No,
might
that
be.
is not semantic memory. No, 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 no. Using instruments or a procedure, what is that memory? It's a procedure, right?
Yes, ma'am.
This is not a knowledge about something. No, it is a procedure. It is a steps wise procedure. So what kind of memory this would be?
Madam is asking whether you require consciousness, like it's a like like what, how, like Madam is asking about
Explicit,
declarative,
implicit, we
non-declarative.
are talking about that
Okay,
part.
okay.
And in the explicit or implicit, which type of memory this becomes? Operating an instrument or operating a vehicle, what kind of memory is that?
Implicit procedural memory, ma'am.
Yeah. So it could even be that, but this is something which has come new, or since the beginning this machine was there.
From the
Is this
last
a
10
difficulty
years she
learning new
using.
machine? So now she's making mistakes in the same machine which she used to use before.
Previously she used to do.
Previously, she on her own she used to do properly. Now she's making mistakes in
Yes,
the same
ma'am.
machine. So what does that mean?
Yes, ma'am.
No. So what does that mean?
Executive dysfunction,
Hmm. It could be one possibility of executive dysfunction, or it could be what else you said? Attention issues, you said. And what could be the third interpretation?
yes, ma'am.
What? Hmm? Could it be a procedural memory?
Don't know, ma'am.
No? Hello?
Yes, ma'am.
Yeah, this
Yes,
could
ma'am.
be a
Yes, ma'am.
procedural memory, na? She used to operate this machine
Okay,
before.
ma'am.
On her own, she used to do these things, na? Now she's not able to do. Hmm?
Okay, ma'am. Okay.
Procedural memory is a type of what type kind of memory?
Implicit, ma'am.
Okay, where will be the localization of that?
Basal ganglia and cerebellum.
Cerebellum nahi hai. इसमें basal ganglia and frontal lobes they are usually.
Okay.
Hmm? So which
Okay,
condition the
ma'am.
procedural memory gets affected?
In
Early.
Parkinsonism associated.
Hmm?
Ma'am,
Sorry?
uh, I didn't get you, ma'am. Voice break
No, in which condition
broken.
procedural memory can get affected early? Hmm? Basal ganglia, you said na Parkinsonism.
Yes, ma'am.
Yeah, so Parkinsonian condition, the procedural memory may get affected early, whereas
Okay.
Alzheimer's and all or other cortical dementias usually they are late.
Okay, ma'am.
Hmm? Or if she had some stroke in the past, maybe. In which territory stroke can cause loss of procedural memory?
ACA.
Hmm. ACA territory. It is recurrent artery of Hubner, the caudate nucleus.
Okay.
Yeah.
Okay.
Hmm. Can you tell me what are the types of memory or classification of memory?
Basing on the duration, immediate memory,
No, I'm
recent
talking
memory,
about
remote,
classification.
like episodic memory, semantic memory,
No, so it will
ma'am.
come under explicit and implicit. Broad classification is explicit versus implicit.
Okay, ma'am. Okay.
So explicit means what? Declarative type of memory means what?
Like things we learned or
Hmm. Hmm.
like events happened
Hmm. Hmm.
previously.
So basically in the beginning, our examiner told whether conscious awareness is there or not. Implicit is there is no conscious awareness during that memory,
Okay.
during
Okay.
that activity. Okay. So we start with explicit versus implicit. In the explicit,
Okay.
what kind of types are there?
Episodic
Hmm.
and semantic memory
Yeah. So episodic means what?
related to events or
Hmm.
functions or
Hmm.
the things that had happened. She's forgetting
In a short period
or
of time. In a
meetings.
short period of time.
Short period.
Semantic is a factual knowledge about something. Okay. Some object or some place. Okay. And it's a long term memory. Okay. And they have
Okay.
also third type of memory, that is working memory. So explicit is working
Yes, ma'am.
memory, then episodic memory and semantic memory. Whereas implicit will have, what are the types of implicit memories? And what is the localization for the episodic memory?
Medial temporal lobe,
Yeah,
ma'am.
hippocampus. And what about the
Yes, ma'am.
attention or working memory?
Dorsolateral prefrontal cortex.
Okay. And what about the semantic memory?
Lateral temporal lobe, ma'am. Middle and
Anterolateral
inferior
temporal.
temporal gyrus.
No, anterolateral
Okay.
temporal lobe. Okay.
Okay.
And yeah, so implicit memory. Now, implicit memory, what are the types?
Um,
Just now we discussed one, na? One of the example, that is procedural memory.
Procedural memory, priming, conditioning,
Yeah. So what is
conditioning,
yeah. So tell me what is priming? Procedural one can understand it.
like
Yeah, drawing or
procedural, like
cycling.
yes,
Like in this
yes, ma'am.
case, it is operating that washing machine.
Okay.
Yeah. Then
Priming means, for example, in but like around 12 o'clock, if we give bell every day and
okay,
after we keep the
tell me what examples you give. What set of tests you give to test for priming in your cognitive testing? What set of tests you will give to check for priming?
no idea.
Can anybody answer this? In your cognitive testing,
Paired learning, ma'am.
Yeah, paired learning. Yeah, paired associative
Okay.
learning. Yeah, that is an
Okay.
example to check for priming. So if you give two sets of words, for example, you give doctor, so then there is an associated word nurse that should come
Okay,
to
ma'am.
their mind. Okay.
Okay, ma'am.
Yeah, table, chair, something like that. Okay.
Okay, ma'am.
So that is paired associative learning. Then what is the example of your which one you said? Classical conditioning.
Classical
And
conditioning.
what is the localization for priming? It's neocortex. Okay.
Okay.
Then what is classical conditioning? Classical conditioning is like a proper Pavlov's experiment was there, no? It is
Yes,
reward
ma'am.
and punishment. It is reward and punishment.
Yes, ma'am.
Okay, associated with a particular stimulus. The localization goes to cerebellum.
Okay, ma'am.
Okay.
I would like
Then
to add that priming is like when you tell one word or
hmm,
any idea, it is an unconscious memory activity.
hmm,
So it influences person to think about the next sentence. In priming also
hmm,
there are different type of priming, like positive
hmm,
priming, negative priming,
hmm,
semantic priming. Like in semantic priming, when you tell the word banana, like what comes to your mind is like yellow. Then there is some associative priming, like when you think about the word cat, it is like when you think about a cat, then it is mouse. Like when you talk about Tom, like the thing comes to your mind is Jerry. The repetition priming, perceptual priming. Like the perceptual priming is like when you tell the word goat, it is like preceded by the faster response will be by boat, goat, boat. Concept will be like desk, chair. So it is like positive priming, negative priming. So these are the different types of power priming which you see. Okay.
hmm. Yes.
Okay. Okay, sir.
So classical conditioning we discussed. Cerebellum is the localization. Hmm?
Okay, sir.
Then what is probabilistic classification learning? That is also one type of implicit memory. And what could be the localization? So probabilistic classification means what? You are able to give a probability. Okay.
Like
So for
whether.
example, yeah. So if you see cloudy things and clouds, and if you see the air, then you can predict that it may rain today. Okay, or it
Okay,
will be
ma'am.
sunny today. So that
Okay.
is like predicting something from cues. Okay, so
Okay,
that
ma'am.
is probabilistic classification learning. Okay, and this also is usually a function of basal ganglia. So two you
Yes,
should
ma'am.
remember: procedural memory and probabilistic classification learning. Both the things are from basal ganglia.
Okay, ma'am.
Okay, so I mean this much, this is a basic of classification of memory. I mean this is what Bradley gives. So I think at least this much you should know. Major classification is explicit versus implicit.
Okay,
Okay.
ma'am.
Hmm. So in this patient, there is a history that there is a little bit of working memory issue, and then there is a
Yes,
little
ma'am.
bit of procedural memory issue
Procedural
also.
memory.
Yeah, which is very odd for any Alzheimer's kind of a dementia. Okay, then.
She asked her husband, "Where did you go?" He already informs her that I am going to the farm,
Hmm.
ma'am.
Hmm.
When he comes back, she asks, "Where did you go?" Without informing me,
Hmm.
like that. If he
Hmm.
tells, "I already told you that I am going," like, "Oh, I forgot," and she tells, "Ma'am."
Yeah. So this is something like a episodic, but also like a short term, isn't
Yes,
it?
ma'am.
So he had told her something, he had given a message, and she has forgotten that. Okay.
Yes, ma'am.
So this is which kind of memory issue?
Episode.
Yeah. So this will become an episodic memory issue.
Yes, ma'am.
Then.
She started asking who are residing in the first floor. Actually, in the first floor, her son and daughter-in-law grandchild are residing, ma'am. She knows
Hmm.
that previously. Now she started asking, no, who are whenever uh, there are sounds from the first floor, or whenever there are talks from the first floor, or some sounds, who are residing in the first floor, like that she is asking. When
Now,
the
so
husband,
what is the meaning of this?
Mm, but whenever the daughter-in-law grandchild comes in front of her, she is able to recognize them, ma'am. That issue is
It's not a
uh,
recognition issue. She has forgotten that somebody
are residing.
close to them used to live on the first floor. What does this mean? There is a meaning behind this chief complaint. What kind of memory this would be? This is also like an explicit memory, isn't it?
Okay,
But
ma'am.
it's a fact. It's a fact. She has
Fact,
forgotten a fact.
episodic
Okay, so
memory.
this becomes a semantic memory.
Okay,
Okay,
ma'am.
yeah.
Okay, ma'am.
Hmm. Then
Uh,
next
mm,
is that she's able to bring household groceries from the shop. What
uh,
information? Acha,
like
you are not able to understand, but is she bringing all the things that are listed, or what? How is she carrying out her
whenever the
activity?
groceries suddenly finished, she goes to the shop and brings, ma'am. This I mentioned for visuospatial navigation outside the house,
See,
not.
going to buy a grocery and bringing the grocery involves lot of activity. Okay.
Yes, ma'am. Yes,
First
ma'am.
of all, you should have a list of number of things they want to buy. Okay,
Uh,
they
uh,
go to buy, then they should have money, and there is an exchange of the money over there. So whether the
monthly
money
groceries will.
transactions are happening correctly or not. When she goes and when she comes back, it also involves visual spatial part. There is
Yes,
also a
ma'am.
calculation part in it. So there are a lot of
Yes,
things that can be tested from your history. But first thing you have to split this. You have to tell ki she remembers the number of objects she has to bring from the market.
actually, all the groceries will be brought by her son, ma'am. Only whenever they are finished, like milk or extra milk is needed, then only, like, extra any atta,
So,
wheat
I
flour,
mean,
then only she goes to the grocery shop, or else everything will bring brought by her husband or son,
so
ma'am.
this is before also, or now this is happening?
No, before also, only son and husband used to bring the
This
groceries.
makes a very limited activity for her.
Yes,
So
ma'am.
it's
Yes,
very
ma'am.
difficult to judge from this. Then,
But socialization with the family members or whoever comes to the home that she knows, she greets them and offers coffee or tea and socializes normally only. They are telling, ma'am.
recognizes also.
Recognizes, ma'am.
Okay. Then,
Able to follow the serials, ma'am.
now see, this is something which is difficult to accept that she's able to follow all the serials. Did you ask what all things she remember?
Actually, I asked
Does
her
she
the
remember
husband.
the what happened in the last episode? That will check what? If you ask
The
her what
serials will
happened
be
in
for,
the
seeing by only wife, ma'am. So he told she never asked why like this are happening compared to the
no.
yesterday.
So that's what I'm saying. So you have to ask her, no.
Yes,
See,
ma'am.
basically, from your history, you're telling that washing machine difficulty or forgetting to switch off the stove. Then it seems very difficult that she's able to follow serials properly.
Okay, ma'am. Okay, ma'am.
Hmm? Because there is a forgetfulness of one day also. I
Yes,
mean,
ma'am.
that much of duration. So then serials, what happened in the last serial, does she remember? Does she recognizes the faces of those people in the serial?
Okay,
Does
ma'am.
she remembers the relation of the people in the serials to each other? Like all these things you have to ask.
Okay, ma'am.
First
Okay,
of
ma'am.
all, does she switch on the television?
Uh, uh, Television operation she doesn't know from the start, ma'am. Her husband only operates the remote,
Hmm. So she has never done that on her own.
and she never had done it. Even the phone also, she doesn't have own phone. Husband
Hmm.
phone only. He dials the phone and gives to her, ma'am.
Hmm. See now, for a female, you can ask two things most, and you have to dig a lot. So one is your cooking, and second digging happens in clothes wearing. Okay, and
Okay,
third
ma'am.
digging is for watching the television because that is the
Okay, ma'am.
most activity done.
Okay, ma'am.
Okay, so the second digging didn't happen. How she wears clothes? What does she
Clothes
choose
she
own
wears
clothes?
normally, ma'am. Personal grooming. She herself. I will explain here, ma'am. Actually, she doesn't require any motivation for brushing or having bath for that. She herself goes and completes the rituals and comes back, and she herself takes the clothes from the almara, matching blouse, everything. She herself only does. He is telling.
Mm-hmm.
Mm.
Okay, okay,
That's why I kept personal grooming is normal.
okay, fine. Then,
She folds the washer clothes, segregates and arranges them in appropriate almara. Her almara and husband almara, different almaras. Wa-
Dipti, just to interrupt, sorry to interrupt you. What is ADL?
like
ADL's
brushing
activity of
teeth,
ADL,
bathing,
ADL.
activities of daily living.
So like how will you like what will you see in your ADLs? Like ADL, what is ADL and what is ideal?
Activities of daily living like brushing and bathing, eating food.
So
These are
whether
the
there like what is basic ADLs and instrumental ADLs?
in instrumented areas for female cooking, washing the clothes, all this comes as instrumental, sir.
So are there any scores or scales available like to just tell about functional decline in such patients?
I don't know, sir.
Have you heard of like CADS index, Barthel index?
Barthel index, I heard, sir. Cats.
Yes, it's just you should just look around and like you can just look about it. ADLs and IADLs, and then there are scores. Like whenever you're telling a history or something at the end, like you can just score it accordingly based on your history. Okay.
Okay, sir. Okay.
Barthel index, CATS index, French essay, functional independence. Such scales are there. Okay.
I will check, sir.
Thank you.
Thank you, sir. Sir, can I continue?
yeah, go ahead.
Continue, please.
Uh, she folds the washed clothes herself and segregates and arranges them in appropriate almara. No obsession or any compulsive behaviors. No history of any collecting and storing the objects. No history of any food cravings.
Hmm.
Sleep onset and duration of the sleep is normal. She falls asleep immediately, even if she wakes up to go to the washroom in the middle of the night. No history of any dream enacting behavior or shouting in the middle of the sleep.
What is
Uh,
dream RBD?
Dream enacting behavior, REM, ma'am.
What is the diagnostic criteria for it?
Mayo's questionnaire in actual in sleep study there is a absence of REM sleep atonia, ma'am.
No, there is a clinical criteria also, no? When do you call somebody has a REM behavior disorder?
They will give complaint like in the middle of the night after sleeping 2 to 3 hours at the middle of the night. They start shouting like um, some buff. For example, I'm giving ma'am buffaloes are coming into the field, go and or hitting thieves are coming, go and catch
Hmm.
like that.
So,
They
hmm. So these are sleep related vocalizations or some complex motor behaviors. Okay. So which
okay.
includes like talking, shouting, screaming, isn't
Yes,
it?
ma'am.
Kicking, and that is what is acting out dreams.
Yes, ma'am.
Okay, so that should be there. So these things that is sleep related vocalization or complex motor behaviors. And
Yes,
then you have polysomnographic result. That is REM sleep without atonia
yes, ma'am.
on polysomnography.
Yes,
Hmm?
ma'am.
And in REM sleep. Okay.
Yes, ma'am. Yes, ma'am.
Yeah, and excessive tonic or phasic EMG activity during that REM. Okay.
Yes, ma'am. Yes.
And it is not explained by any other sleep disorder or
Yes.
some psychiatric disorder. Okay. Or
Okay.
epilepsy. So no other like other conditions. So that will become the diagnostic criteria.
Okay.
Okay. So yeah, so that is what I mean. Why did you ask that history here? In which conditions you get this REM behavioral disorder?
In synucleinopathy disorders, we will get REM sleep behavior disorder.
Encephalopathies. Okay. Or synucleinopathies like
MSA, PD, Parkinson's disease, DLB.
yeah. Any other condition where you will get this RBD? MSA you said. Then DLBD you can get.
Yes, ma'am.
PD you
PD
can
also
get.
normal,
Yeah.
idiopathic PD as
Narcolepsy is not same as RBD. There's a gross difference between them. Okay.
ma'am.
No, somebody has written.
Okay.
Uh, any other condition where you get RBD? Yeah, somebody has answered. Iglon 5. Very significant
Yes, ma'am. Yes,
brain behavioral disorder can be there in
yes,
Iglon
ma'am.
5. Okay. Okay, fine.
Yes,
Next.
ma'am. No history of any suggestive of any visual hallucination.
Hmm.
No history of any excessive laughing or crying to inappropriate situation.
Hmm.
No history of any weight loss or loss of appetite.
Hmm.
No history of slowing of activities of daily living, ma'am.
Hmm.
No history of any changes in the gait or tremulousness of the limbs, or no
Hmm.
history of any falls.
Hmm.
No history of any involuntary movements of the limbs.
What visual hallucinations are you expecting? And why are you expecting visual hallucinations?
In dementia with Lewy body disease, there can be visual hallucinations like seeing children or animals.
Mm-hmm. Hmm. And can you tell me what are the types of visual hallucinations?
Formed and unformed.
Hmm.
In formed, there will be completely, they can see the completely formed creature like animals or
It's always
human
better to
being.
start with unformed, na? Because they're more simple, isn't
Okay,
it? They're
okay,
two-dimensional.
yes, ma'am.
Hmm?
Okay.
They're two-dimensional. So they're coming from which area of brain?
Temporal and occipital, ma'am.
No, no, no. Temporal is fully formed visual hallucination.
Formed, yes, ma'am.
Pure occipital.
Unformed for
Pure
occipital,
occipital. Pure
yes,
occipital.
ma'am.
Okay, pure occipital are simple, unformed, two-dimensional hallucinations, which means there
Yes,
can
ma'am.
be just shapes,
Lines,
geometric
yes,
patterns, dots, lines. Okay, and usually they are black and white, not like
yes, ma'am.
colorful as such. But in occipital seizure, you may get colorful, uh, the colorful unformed hallucinations. In migraine aura is usually black and white. Isn't it?
Scintillating scrotum.
What is Charles Bonnet?
In blind patients, there will
Hmm. Then you go to the parieto-occipital area. What kind of hallucinations you get in that area? They are a little more complicated.
yes, ma'am.
So they become more formed.
Weird images.
Hmm. So they get closing in kind of hallucinations. So they are standing in a room and walls are closing in on them.
Okay, ma'am.
Okay. Yeah. So that is like parieto-occipital region hallucination.
Hallucinations.
Then you
Okay.
go to temporal lobe. There you get proper people, faces, animals, insects.
Okay, ma'am.
That kind of hallucination. What is peduncular hallucinosis?
Even after the removal of the stimulus,
No. That is palinopsia
yes, ma'am.
after images, isn't it?
Yes, ma'am. Yes.
Usually they are occipital features. Even polyopia is also occipital. Multiple
Okay, ma'am.
copies. Yeah. But what is peduncular hallucinosis? Or what is Alice in Wonderland syndrome?
Uh, Proportion of the sizes of the images will be distorted.
Hmm. It comes from which area of brain?
Occipital.
No. That is from brainstem, no?
Oh, okay.
If at this stage patient starts hallucinations, what will you call it as?
Don't know.
You can say that either it is a dementia which is advanced, or if it is
Okay.
happening early, then we will say DLBD, but it has to be fulfilling that criteria, no?
Yes, ma'am.
DLBD
Yes.
should have proper
Visual hallucinations, Parkinson's, REM sleep
yeah.
behavior.
So that kind of features are not there, so it is
Yes,
less
ma'am.
likely. Hmm.
Yes,
Then why did you ask for this excessive laughing and crying?
ma'am. Pseudobulbar effect.
Okay.
Actually, she is hypertensive diabetic, ma'am, from last 25 years. That's why I asked this also from
Mm-hmm. Mm-hmm. What could be the localization if you have the pseudobulbar pseudobulbar
corticobulbar
effect?
tracts.
Is that the
Corticobulbar
only
tract.
localization? Is that the only localization? How many localizations are given in the Bradley? You are right about corticobulbar tract, but which all areas in the corticobulbar tract? Hmm? Commonly in your cases, you must have seen it, na? So where do you think you most commonly you have seen pseudobulbar? Which area?
In periventricular
Yeah,
strokes,
correct.
small
So it's
vessel
bilateral.
disease.
Yes. So bilateral periventricular area, you tend to see that. Okay.
Yes, ma'am.
Then which other area it can happen?
Medial prefrontal cortex.
Okay. Then bithalamic.
Okay, ma'am.
Okay. Then even in the cerebellum, it can happen. Okay.
Okay.
So yeah. So what is the difference between the pseudobulbar effect versus the the laughing pattern seen in the cortical dementia, like frontal lobe dementia?
Emotional ability and emotional incontinence.
Hmm. See,
Ma'am.
pseudobulbar tends to be more of subcortical. Okay.
Yes,
So
ma'am.
if you have a frontal lobe dementia, which is a cortical kind of disease, so you can get inappropriate smiling and crying in those areas also. But there is a difference in there. What is that difference?
Uh, Affect and mood, they are not incontinent I mean, incongruous in case of
Yes. So in that is one thing. There is
or be different.
inappropriateness.
Yes,
But it is the sense of jocularity that has changed. Sense of humor has changed in them. Okay.
okay,
There
ma'am.
is a change in the sense of humor. So they may become suddenly too sarcastic or foul or obscene. That is the change in their jocularity or jocularity basically. Here it is one stimulus is there and they are excessively laughing. It is a laughing stimulus and they keep on laughing. Or it's a crying stimulus, they keep on crying.
Okay,
Or
ma'am.
sometimes there is no laughing stimulus, there is a laughing stimulus and they keep on crying. That is inappropriateness. That can still happen in the pseudobulbar, but in the cortical dementias, frontal lobe dementia, the change in the sense of jocularity. Okay,
Okay, ma'am.
yeah, fine. So next slide.
Next, uh, past history.
Hmm.
Ma'am, before that, no history suggestive of cranial nerve involvement or any weakness or no history of
Focal
any
deficit.
ma'am?
No focal deficits.
No focal deficits or
Yeah.
no history of any tingling sensation or paresthesias or numbness. No history of any syncope, palpitations, dryness of the limbs or excessive sweating
Hmm.
or postural giddiness. Ma'am.
Hmm.
Coming to past history, diabetic on oral hypoglycemic drugs from 25 years, hypertensive, taking antihypertensive medication from 25 years. Known
You have to write
hypothyroid.
whether controlled or uncontrolled. That you have to write in the bracket. Okay.
Okay, ma'am. Okay, ma'am. Okay.
Then
When she came to us, she's
What
uncontrolled.
cognitive decline like? Hello,
Sir,
hello. Am I audible?
hello, sir. Yes, sir.
yes,
Hello,
Audible,
yes,
am
sir.
you
I?
are audible, sir.
So, like, how uncontrolled hypertension can like accelerate cognitive decline? Like, what can be the mechanism uncontrolled hypertension?
Vascular cognitive dementia.
That it can cause, but like,
Yes, sir.
how like biologically it accelerates the cognitive decline? Like, what different pathology, like what different things it can cause? Like, for example, hypertension can induce lipohydrogenesis, which can
Yes,
lead to like infarcts.
yes, sir.
Endothelial dysfunction can lead to chronic hypoperfusion.
Yes.
Microbleeds can lead to CA like pathology, lymphatic clearance. So, like, I was asking about that. Okay, continue. Thank you.
Hypothyroid from 25 years on medication. No history of any cerebrovascular attacks or coronary artery disease or no history of any bronchial asthma. Treatment history, she is on Silidin T once daily, Storva AV 20 once daily, Maricu 10 once daily, insulin mixed at 10 units subcutaneous at night time, 10 o'clock, Donamem 5 mg twice daily. She started from 10 days only. Coming to personal history, she takes mixed diet, attained menopause around 50 years. She had two male children, normal vaginal delivery, no significant obstetric history, obstetric event. Coming to family history, burnout of non-consanguineous parentage, second in birth order. Her mother and brother are died from cerebrovascular attack. No other family members are suffering from similar neurological illnesses or any other neurological illness.
Okay. Next.
Summary.
Summary. Hmm.
65 years old female, hypertensive and diabetic, hypothyroid on regular treatment, but it is diabetes is well controlled, ma'am, but hypertension is not well controlled. Presented with insidious onset, gradually progressive, cognitive deficits in the form of impaired attention, lack of interest in previously pleasurable activities like going to temple, increased anger over the trivial issues, forgetting to uh, executive dysfunction, like forgetting to change the washing machine mode.
Oh, see, when you are summarizing,
Okay,
okay,
ma'am.
yeah. So you have to summarize, and then you have to give structural localization, and then you
Okay,
have to
ma'am.
give your proper differential diagnosis. Okay. Uh, so there is a cognitive decline since 1 year. How many
One
years
and
does
a
it
half
have?
year. 1.5 year, ma'am.
Yeah, in the form of one is this in the form of your writing, you have to write the episodic memory.
Okay.
Okay. So
Mm.
you have to write what are the examples of episodic memory then.
Okay, ma'am. Okay.
Okay. Then
Okay.
you have to write what else? There is a difficulty in carrying out the activity like washing machine operating.
Okay, ma'am.
So there could be, then you write over there ki it could be an example of executive memory or executive function, or it could be a what did we discuss last time? No, procedural memory.
Procedural, ma'am.
Yeah. Okay. And then third point is it could be difficulty. It is lack of interest in doing the previously pleasurable activities, which means what?
Apathy. But
Yeah.
that severe is not there, ma'am. Only going to temples she stopped.
Hmm. So that you have to write. Okay.
Okay, ma'am.
And then you have to come down and then you write the structural localization for each of these symptoms.
Okay, ma'am.
Yeah. So just we forgot to discuss on this point. Lack of interest in previously pleasurable activity means only one activity, which was the temple going activity.
X, ma'am.
But then previously she was a religious person and now she has become non-religious, or what is the story?
She didn't become non-religious, ma'am. Now also she is doing puja in the house. Uh, she just decorates the idols and she prays, ma'am. She won't chant any mantra. He told, ma'am. Just she decorates the.
Does she decorate it properly like before, or it has changed now? She's doing it haphazardly, or she's not doing it in a sequence, or thing. The idols are kept in a haphazard way, or any of that. You have to ask that history.
Okay, ma'am. Okay, ma'am.
Okay.
Okay.
But is this an example of apathy? Just from one example, it's very difficult to judge. But is
Yes,
this an
ma'am.
example of apathy?
No, ma'am. No.
There could be again many meanings behind it. You have to ask her whether she finds it difficult to go to temple. Is she losing her way, or she just has no interest? Because television she's watching, you're telling. Then whenever somebody comes to home, she greeted them. That's what
Yes,
you
ma'am.
mentioned in your history.
Actually, I forgot to mention one thing, ma'am. Whenever her husband telling about the complaints she is having,
Hmm.
she's becoming aggressive, madam. Why are you telling like that? I didn't have that complaint. I told that she's shouting when she
Can you
misplacing.
tell me what is the difference between apathy and depression?
In depression,
What is
there
the
will be
1 minute? You tell me the differences between apathy and depression, and also you tell the differences between apathy, empathy, and sympathy.
okay. Between apathy and depression, in depression there will be clear cut demarcation before to the onset of the depression and after the
No,
onset of
no, no,
depression.
no, 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 no. That you cannot say. That is not a first differential diagnosis. First differentiating feature. See, you are presenting like an exam, and exam may you have to speak like an exam case
Okay, ma'am.
and standard answers.
In case of
See, apathy is a defect in the
medial
no,
prefrontal
no,
cortex.
no, 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 no. Achha, whatever it comes to you, you keep telling, then we'll change, add to it. What is mainly affected in apathy and what is mainly affected in depression?
In apathy, if we motivate the individual, they can start doing the activity, ma'am.
Yes. So coaxing works in apathy, coaxing doesn't work in the depression.
Okay.
Even if you tell them 1,000 times, they will say, no, I will not do. Okay. Whereas you repeatedly ask somebody with apathy, they will start doing something,
Okay.
however wrong it is. Okay. So that is the
Okay.
first difference. Second thing is all the complaints are told by the husband.
Depression.
Depression people will keep on telling
Telling
themselves
complaint.
these many complaints are there and multiple somatosensory complaints would be there.
Yes, ma'am.
Okay. Then there is suicidal tendencies if there is a severe depression.
Yes, ma'am.
Food changes. Okay. So food changes like excessive
Sleep and
eating or decreased eating or decreased sleep or excessive sleep. These features more are a feature of depression. Then main important thing is that depression there is impairment in the attention. Attention is the cognitive issue with the depressed people.
Okay, ma'am.
Whereas in apathy it could be episodic memory or other cortical features.
Okay, ma'am.
And in apathy, in depression, it's a mood disorder. Whereas apathy is an affect disorder.
Okay, ma'am.
Okay. So you have to have standard answers for all of these because this is quite commonly asked question.
Okay,
Okay.
ma'am.
If nothing else you are able to answer, at least you should be able to answer apathy versus depression. That's what they expect.
Okay.
Okay. And what is the definition of apathy, empathy, and sympathy?
Empathy, ability to perceive the emotions of the other individuals, ability to understand the emotions of the other individuals, empathy.
Apathy first you tell.
Lack of
Lack of motivation.
yes, ma'am.
Then empathy. What you told is correct. So they are able to understand and feel other person's emotions or from their perspective, isn't
Yes,
it?
ma'am.
Yeah.
Yes,
And
ma'am.
sympathy is what? Just compassion.
Emotional, yes, our
They acknowledge that they are sympathizing with them, but they don't actually feel what they are going through. Okay, so that is sympathy.
okay, okay.
Okay. So from your one history is very difficult to judge, but where is the localization of apathy?
Medial prefrontal cortex, ma'am.
Okay, medial frontal cortex. Okay. So, from your history, tell me what are the structures affected in your patient?
Uh, Structures affected dorsolateral prefrontal cortex,
Okay.
medial hippocampus,
Hmm. Because of
the
episodic and
episodic. One, one might be we thought of a procedural memory as well. So cerebellum.
cerebellum, no. Procedural memory is
Sorry,
basal
ma'am.
ganglia,
Yes, ma'am. Basal ganglia.
but there is no other features of basal ganglia. First of all, tell me whether this patient has a dementia or not. And what is the like? What is the criteria for dementia actually? What is dementia? Now it's not called as dementia, no? It's a major neurocognitive disorder.
Oh,
But does this patient really have dementia?
yes, ma'am.
Based on what will you say that this is a dementia?
Involvement of cognitive domain, at least one domain involving among the six domains affecting her activities.
See, you have to be able to answer this very rapidly. Okay, so what is the DSM cognitive domains? DSM-5 cognitive
Significant
domains.
cognitive decline from the previous level of performance, ma'am.
Yeah, tell me what are the 6 domains? 5 6
Complex
domains.
attention, executive function, learning and memory, language, perceptual motor, social cognition, ma'am.
So in her, what all which is affected? See, you go from frontal to occipital lobe. Frontal is your attention and executive function. Then temporal is your learning memory. Okay.
Ma'am, I'm unable to hear you, ma'am.
You go from frontal to occipital lobe.
Hello, ma'am.
Hello.
Ma'am, can you hear me?
Hello.
Hello, ma'am.
Yeah. Am I audible?
Yes, ma'am. Now audible, ma'am.
Yeah. You go from frontal to occipital. So it is frontal is attention and executive
Yes,
function. Temporal is memory.
memory.
Parieto-occipital is called as not visuospatial. Visuospatial word is gone from the DSM criteria. Okay.
Perceptual motor.
Yeah, it's a perceptual motor deficits.
Yes, ma'am.
Okay. Somebody has written in the chat visuospatial. It's not there in the DSM criteria. Okay.
Okay,
Then,
ma'am.
then frontal also is there. Social cognition.
Yes, ma'am.
Okay. So in her, what is affected?
Attention, executive function, and memory.
Okay. But is it affected enough to affect the activities of daily living?
Yes, ma'am.
In what sense?
Now she is unable to perform, operate the washing machine, and the other thing is cooking. While cooking, sometimes it is she is not forgetting to off the stove, so sometimes it is burning.
Yeah. So that is something significant. It is affecting her activity of daily living. Okay. So I will call this as a major neurocognitive disorder.
Okay.
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 Which one? What are your differentials according to all of this?
As she is having hypertensive and diabetic, I want to rule out vascular dementia as well, ma'am.
So that is your first differential?
For reversible causes, I put first differential as.
No, not for reversible. Is this vascular dementia is reversible? First of all,
Not
it's not called as vascular dementia. What is the latest terminology being used for vascular cognitive impairment? Yeah, somebody has written here. VCID. What is VCID?
Vascular cognitive impairment.
So easy. Vascular cognitive impairment. And what is D?
Degeneration.
Hmm?
Degeneration.
Hmm? It is vascular cognitive impairment and dementia, no? VCID.
Okay.
But what is VASCOG 2 criteria?
Ma'am?
VASCOG 2 criteria. It is the latest criteria, has come up in September, I think. Yeah, September or October. For the vascular dementia.
Okay.
It's a diagnostic criteria. What is VASCOG 2? What was VASCOG 1? That was a diagnostic criteria for vascular dementia terminology before. VCID. What is the diagnostic criteria? VASCOG 2. What all things should be there?
At least one cognitive domain involvement along with cerebrovascular disease.
Hmm.
With impairment of activities of daily living, then major, ma'am.
No. We are talking about VASCOG 2 criteria. What is that VASCOG 2 criteria? And how it has changed compared to before? Any idea? So you have to go through that, VASCOG 2 WSO
Okay,
20,
ma'am.
25 criteria. They may ask if you utter this vascular dementia, you should know in and everything about it.
Okay, ma'am.
So basically, it includes preclinical vascular cognitive impairment also, mild and then major. Okay.
Okay, ma'am.
Yeah, and in that you have this one or more cognitive domain involvement, and whether it involves the activities of daily living or not, that will be there. But the main thing is that beyond 3 months, cognitive
Decline
progression.
should.
Yeah. Okay, and they are also using the Strive diagnostic criteria for MRI. Okay,
Okay, ma'am.
that is a Strive diagnostic criteria for MRI they're using because that has added few more things. Like for example, they have added the microinfarcts in the MRI. Okay,
Okay, ma'am.
and so you should know what is VASCOG 2 criteria. Okay,
Okay, ma'am. Okay.
and they always give more attention to the involvement of attention, executive function, processing speed for vascular dementia. That is very, very
Yes, ma'am.
important for vascular dementia. Processing speed. That slows down if it's a clear vascular dementia. From your history, there was no previous any CVA history also.
Strokes. Yes,
So it's
ma'am. Yes,
very,
ma'am.
very difficult to say as a vascular as a first possibility. What is the most common dementia? She's 60 plus. What's the most
Alzheimer's.
common dementia actually? Statistically speaking, what is the most common dementia?
Most common Alzheimer's.
Alzheimer's is the most common. Hmm?
Yes, ma'am.
So why are we not saying that this could be first Alzheimer's only? Because your episodic memory was affected, your attention is affected, a little bit of apathy is there. But episodic memory, you gave lot of examples for her.
Yes, ma'am.
So why not Alzheimer's? Why FTD and vascular first? Is she fulfilling the diagnostic criteria for FTD?
No, ma'am. Not fulfilling.
You have right. You yourself have written FTD. It should not be there at all because there is no diagnostic criteria getting fulfilled over here. What is the
Yes.
diagnostic criteria for FTD?
Uh, Behavioral disinhibition, apathy, empathy,
So tell me, total 6 points are
perseveration.
there. 1 minute. There are
Yes,
total
ma'am.
6 points.
Tell the 6 things.
Yeah, that's what.
Ma'am.
6 points are there, no?
Yes, ma'am.
So tell 6 points point wise.
Okay, ma'am. Loss of social disinhibition, lack of apathy or inertia. Sorry, apathy or inertia, lack of empathy or sympathy, hyperorality, perseveration, um, absence of involvement of visuospatial, perceptual motor cognitive domain, and
Yeah, so you have the idea that there are six criterias, out of which three have to be
yes,
fulfilled.
ma'am. Yes, ma'am.
So in your patient,
Yes,
how many are getting fulfilled? Besides one, nothing else.
yes, ma'am.
That attention and executive function, there is nothing else. It's not, there is no fulfillment of diagnostic criteria. So you can't put FTD there.
Okay, ma'am.
Most common with episodic memory, what is the most common dementia with episodic memory?
Alzheimer's disease, ma'am.
Yeah, so
Initially
that
starts
you
with
have
the
to
episodic
change.
memory.
Yeah, you have to change your sequence of differentials here,
Okay, ma'am.
and also it changes your viva questions then. Understand? So that's why,
Okay, ma'am.
yeah. So Alzheimer's is one thing you can put. There is a very short duration history, rapid progression. Maybe you can put mixed rather than putting just vascular. You can put
Okay.
one degenerative plus some vascular, maybe.
Okay.
Okay. FTD is not getting fulfilled here at all.
Yes, ma'am.
Chalo, examination.
On general examination, well-built and nourished, well-dressed and well-mannered, right-handed individual. No pallor, no icterus, no cyanosis, no clubbing, no lymphadenopathy or no pedal edema. Coming to vital data, her blood pressure is 190 by 100 in supine position, pulse rate 86 per minute, regular, no normal in volume, regular, no radial delay or radiofemoral delay. All peripheral pulses were felt. No postural drop is noted. Coming to mini mental status examination, studied till 3rd class. She scored 11 out of 30. Orientation to the hospital, city and state is present. Orientation to season is present. In registration, only 2 words that she is able to register out of 3. Attention and calculation, even simple calculations 20 minus 3 also she is unable to do. Recall unable to do even with cues. Language, naming out of 1 out of 2 objects she is doing. Repetition is intact. 3-step command able to do. Written command and writing a sentence
Let
she
me
is
just
unable.
interrupt here. If she
Ma'am?
is studied till 3rd class,
Yes, ma'am.
then why have you done MMSC?
Ma'am, proper lobar functions also I did.
Correct. But if somebody has only education till 3rd class, what should you ideally use? What cognitive testing you should ideally use?
Don't.
Can you just
Instead of
tell about the
MMSC,
cutoff, like MMSC cutoff for uneducated persons, 11th, 12th, high school, and like
For
if patient
uneducated,
is
it is
illiterate, what? If patient is
cutoff is
illiterate, like
19, sir.
what other things we can use, like
Sir,
which other test, like little more, like more related to dementia, like will involve more domain of dementia, will cover more domain.
others like Mocha or Fab, all there, sir. But
no, instead of MMSC, what other test is there? HMSC is also there, na? Or you will do it only in uneducated person?
Actually don't know, ma'am. I don't know it.
For her education status, what should be the cutoff for MMSC?
19, madam.
From the third standard education?
3rd standard means almost uneducated only, ma'am. Because at least the primary
Yeah, so
schooling.
this is a low literacy issue with her, na? So
Yes,
you
ma'am.
should go for the HMSC. She may score a little better over there. From your complaints, nothing much was coming actually. Then
Mocha. Trial B, she unable to understand as well
go
what.
back. So orientation to time and place we do, right?
In a time and place, for hospital, city and state, she is able to tell,
No,
ma'am.
but there
But
are
they,
5 points for time and place, na? Each.
yes, ma'am. Yes, ma'am. In that, she is able to tell hospital, city and state, but floor, she is unable to tell floor and the country name.
Then that is important that you write, na? She didn't tell the floor and country, and in
Okay,
the
okay.
orientation to time, how much score she got. That you write.
Three she got in the place, ma'am. In the time, she got only one date, month, year,
But was
and
she
day
aware
she
of
is
all these
unable.
things before? Day at least she used to tell, or she used to know the season, etc.
She used to know season and the day, madam.
Okay. You write the score over there, how much she, and we in the always the points in which she lost is more important, not
Okay,
the
ma'am.
points which she gained. Okay.
Okay, ma'am.
And what is the meaning of loss of all this orientation?
To know whether
No,
she
no.
is
I mean, she lost orientation to time and place from your examination. She's lost that. So, what does that mean? It is episodic memory.
okay.
Hmm. When you check 100 minus 7, what are you
Uh,
actually checking? Is it calculation? It's no.
Working
It's a
memory.
backward. It's a backward attention.
Okay, ma'am.
Okay.
Okay.
Hmm. So recall was 0.
Yes, ma'am.
Hmm. So
Even
she lost
registration
point in
also,
recent
she
recall.
is able to register only 2 out of 3, ma'am.
Okay. But it fared better than the recent memory issue.
Okay.
Hmm. Then
In naming for 2 objects, she named only one correct, ma'am. The other for AC remote, she is telling phone.
mm-hmm. Okay, we'll go ahead.
Mocha trial B, she's telling I am unable to understand what you are asking me to, so she didn't attempt it, ma'am.
Hmm.
In the naming for rhinoceros and camel, she is unable to name. She
She
named
is
wrong.
so uneducated. You have to start asking, of course. See, cognitive testing is your cognition also and her cognition testing also.
Okay.
See, if she is not studied much, she won't understand all of this. So you can ask all these uh, deities, okay, gods and
Okay,
everything.
ma'am.
Those pictures you can show. Okay, maybe she'll be able to name them or something.
Gods, she done, ma'am.
Hmm. And the day-to-day routine uses you can ask, na?
Yes, ma'am. I did
Rhinoceros and
it,
all they
ma'am.
won't be able to name.
Oh, I did it in lobar functions.
So that's what I'm
Uh,
saying. So
okay.
I'm not sure if she has a naming issue. We'll go ahead and see.
Okay.
Because her attention is also not very good.
Yes, ma'am.
Hmm.
Cube drawing, she had drawn in this way, ma'am. This
Hmm.
for clock drawing, copying, she done like this, ma'am.
So what does this mean, clock drawing?
Circle is almost correct, ma'am.
Hmm.
Spatial orientation of the digits is correct, but the numbers are wrong, ma'am.
So what does that mean? Numbering is wrong.
She might
What are the
might
types of error? Can you tell me what are the types of error, clock errors?
perseveration phenomena, ma'am.
Okay, perseveration is repeatedly putting the same number
Yes, ma'am.
or
Yes, ma'am.
putting extra hands.
Yes, ma'am.
Yeah, so this doesn't look like that. Then what are the other errors?
Graphical difficulties.
Graphical means what?
Clock will be drawn like not like circle, ma'am. Graph.
Yeah, so the and it will be very haphazard. So clock
Yes,
drawing
ma'am.
will be difficult.
The
That is a
conceptual
graphical area.
yes, ma'am. Conceptual deficits.
Hmm. So they may not draw a clock only. They may draw a rectangle, or they may just keep on drawing something inside that circle. Okay.
Yes, ma'am.
Yeah. So this is not a perseveratory error. This is not a conceptual. She has understood a little bit that
Yes,
there
ma'am.
is a clock to be drawn, there is a circle, and you have to put numbers in it.
Okay.
So this much is there, but size is okay. Size error also there. Graphical errors happen. What is stimulus bound response?
In stimulus bound response, if we ask the person to draw label the clock 11:10, he labels it 10:11, ma'am, rather than 11:10
Yeah.
time.
So they're fixated on that 10.
Yes,
Okay.
ma'am.
So that is an error. Then there are visual spatial error. Is this a visual spatial error?
No, ma'am, there is no hemi-neglect or
So she has put numbers in all quadrants, but they are not in
yes, ma'am.
sequence.
Yes, ma'am.
So it is just it is usual. It could be an executive error basically.
Okay.
Okay,
Okay.
and you should know how much points one loses in each thing
For
in
circle
lockdown.
1,
Yeah.
ma'am. For circle 1, labeling 1. For hands 1 in Mocha.
In Mocha, yes.
Yes, ma'am. In Mocha.
Hmm.
Registration out of 5, only she is able to register 2, ma'am, even after 3 trials. Attention for forward digit 3, ma'am. Backward 0. Tap A commission errors are there, ma'am. Serial subtraction unable to do. Language normal. Lexical fluency 0, ma'am. Abstract only she is able to tell for 2, ma'am, out of 3. Delayed recall unable to even with cues.
This
She's
shouldn't.
unable.
What you are checking over here exactly?
Ma'am?
So this slide, what you are checking?
Ma'am, this in the Mocha only, ma'am.
Okay.
She is unable to tell the floor and state name, country name, sorry. Time in orientation to time, date, day, month, year, she is unable to tell. She secured 8 out of 30, ma'am.
Okay.
Coming to frontal assessment battery, similarities she is able to tell 2, ma'am. Lexical fluency 0. Motor luria she is unable to. Conflicting instructions also she is unable to do. Go no go 0, ma'am. Prehension is 3. Prehension is normal.
How
Coming
much
to
she scored in Fab?
5, ma'am.
Okay.
5 out of 18. Coming to frontal lobar function, insight is absent, ma'am. Digit forward is 3, backward is 0, ma'am. Tap A commission error, similarities 2. Differences she is able to tell, ma'am. Fund of information like.
See, in frontal, 1 minute. Go back to the Fab score.
Ma'am.
So tell me, similarity checks. What all? What does it check? Which frontal circuit it checks?
Categorical fluence. Sorry.
Eh?
Not, ma'am. Sorry. Similarities.
See, what are the 3 frontal lobe circuits? Subcortical circuits.
Medial, orbitofrontal, and dorsolateral prefrontal.
Correct. So now you have to tell the Fab. Usually, each point of Fab checks 1 lobe.
Okay.
So
similarity. Dorsolateral prefrontal cortex.
Correct. Lexical fluency.
Lexical also dorsolateral prefrontal, ma'am.
Then
lexical
motor
fluency.
luria.
Motor luria also dorsolateral prefrontal con.
Okay. Then
conflicting
instructions.
Conflicting go no go as well dorsolateral prefrontal.
No. Here it goes wrong. Conflicting is checked. Go no go is checked in the
response inhibition orbitofrontal.
Orbitofrontal. Okay. And conflicting instruction orbitofrontal.
Yes, ma'am. Prehension.
Okay. Inside inside then abstract thinking which we checked. So, like you give some proverbs and you check. Okay. Go ahead. Go ahead. Next this thing. So abstract thinking. See, inside judgment and abstract thinking that should come one below the other.
Okay.
You have already checked your digit forward, backward, tap A, everything you have done before. You shouldn't mention it over here.
Okay.
Inside judgment, abstract thinking. These 3 should come together here. So
Okay,
after in frontal lobe, Fab score happens, then inside or you can start with inside judgment, abstract thinking, and then go to Fab score. Okay. And then you go to trail and trail B.
Okay,
Then
ma'am.
you go to Stroop test.
Okay, ma'am.
And then you go for perseveration.
Okay.
And then you can check the frontal lobe release signs.
Okay.
Understand?
Okay.
Then?
Trial A.
Nothing. Registration is only not there. Next.
Only from 2 to 3 she done, ma'am. From there she is not doing. Trial B not attempted, ma'am.
Okay.
Categorical fluency for vegetables she named 3, ma'am. For animals she is able to name 8. Lexical
Where is
fluency.
the localization for categorical fluency?
Temporal lobe, ma'am.
Which temporal lobe?
Anterolateral.
Yes. Yes. And it's usually affected early in which dementia?
Alzheimer's, ma'am.
Huh. Then what you have checked this?
Visual pattern completion. I asked her to complete this diagram, ma'am, but she started drawing from below and she did like that.
What is this called as? Is this a set shifting?
As ma'am said, shifting the
Huh.
mental flexibility.
Yeah. So this is a set shifting test. Okay. She's not able to do it, and she's not understood
Yes,
also
ma'am. She
what is
not.
supposed to be done.
Yes, ma'am.
Then next,
Motor luria, she is unable to do, ma'am. Fist palm,
that we have checked in Fab already.
frontal cord,
Hmm.
go, saccadic and anti-saccades, she is unable to do. Stroop, she unable to understand as well, ma'am.
Okay. So there is a significant involvement, but there is, see, all of this pattern can also get affected because of severe attention issues.
Yes, ma'am.
Okay. Then
Language, spontaneous speech, fluent, ma'am. Comprehensive. Naming 1 out of 3 is correct. Repetition intact, ma'am. Reading and writing, she is unable to do for her education level.
what is a normal fluency?
100 to 150 words per minute.
And when you call somebody as non-fluent, non-fluent is less than 7 words in a sentence.
Okay.
Hmm?
Okay.
Just this comprehensive means
Okay.
what? What all things you checked in your comprehension?
When I asked her to, ma'am,
What all things you checked for comprehension?
I had given a paper to fold it here and put it under the pillow,
No,
ma'am.
no.
That she
How do you
was
no
able
no?
to do.
How do you check comprehension?
Different tests for comprehension, like subtypes, like
Asking to touch the ear with the. Hello, ma'am.
Hmm. I am listening. You have to
We will
answer.
we will ask to show the nose or show the fingers.
You have 5 points in testing comprehension.
Yes, ma'am.
One is your simple comprehension.
Yes, ma'am.
So what is that? What you told? Stick out tongue. Show me the light. Show me pankha, the fan. Then
Yeah, if anybody wants to participate, they can
yeah,
unmute.
somebody can answer this.
Dr. Nidhi, if you want to answer, you can unmute yourself and answer.
Yes,
Dr.
sir.
Nidhi.
Yes, sir. Simple comprehension and complex comprehension, ma'am. Simple comprehension में initially we can ask like where is the fan, where is the table, and then in sequence where is the table and then where is the fan, and
1 step, 2 step, 3 step also you
three
can do.
steps.
Like
हाँ,
you ask
three
them
steps.
to show finger,
हाँ,
tongue, then the door, and then fan. Like that in sequence also they can answer.
yes,
Okay,
ma'am.
so that is simple comprehension. In that it is either pointing commands or 1 step, 2 step, 3 step commands. Okay.
Yes,
Yeah,
yes,
so that
ma'am.
is simple. Then what is complex comprehension?
Uh, um, I'm not able to remember it, ma'am. Sorry.
Okay. Complex comprehension is you give a sentence ki if there is a dog and there is a cat, dog eats the cat. Who remains?
Yes, ma'am.
Okay, so that
Yes,
they
ma'am.
should be able to answer. This is a complex sentence comprehension basically.
Yes, ma'am.
Okay, then third is what kind of comprehension?
Mm,
So simple sentence, complex sentence comprehension. Okay, then there is yes no comprehension. What is yes no comprehension?
uh,
Is this a hospital or temple
No, that
like
is
that?
very obvious. So that is very obvious. You have to ask something which may not be obvious. Like you had a
Okay, ma'am.
vomiting today in the morning. So then they should answer no. Okay.
yes.
You can't ask somebody has said ki whether the sun rises from west. Okay. So that they should answer in yes or no. Okay.
Yes, ma'am.
Then next is conceptual comprehension. Okay, what is conceptual comprehension? If you are sitting in a room and you want to tell the timing, then what instrument will you use? So they have to point at the clock and say clock. That is conceptual comprehension. Okay, and the last one is single word comprehension. Most of you don't do this. Single word comprehension. What is single word comprehension? This is the single most important test that you are supposed to do in a semantic dementia.
No idea, ma'am.
So you have to give them an object, okay, or an animal, and you have to ask for the category. So palak kya hai? So they are supposed to answer it is a vegetable.
Vegetable. Okay.
Okay, sher
Hmm.
kya hai? They are supposed to answer it is an animal.
Hmm.
Okay, so single word comprehension is impaired in semantic dementia.
Hmm. Yes,
It
ma'am.
might simple sentence comprehension might be normal in that, but the
Hmm.
single word comprehension is definitely affected in semantic dementia. So that is the fifth one. So you have to answer like comprehension when you're checking these five things you should check.
Yes.
Okay.
Okay, ma'am.
Hmm. And in naming also, you start off with the commonly used objects in her daily life. Like for example, she has a spectacle, so you can ask what is this, and then you can ask the parts of that object.
Okay, ma'am.
Okay, then you can ask for the body parts.
Okay, ma'am.
And then you can turn over to the pictures and naming them. Okay. Usme bhi it is very
Okay, ma'am.
difficult if you show a picture because is it a visual agnosia or is it naming difficulty? Okay. So for naming, actually we go for the verbal only usually. Okay. Yeah.
Okay, ma'am.
So I wanted to know whether she could tell the body parts, etc.
Body parts she is unable to tell, ma'am.
Like if you ask her to show where
Parts
is
she
her
is able to tell.
nose. Hmm. But the parts of the object she is not able to tell. Hello.
Hello, ma'am.
Yeah, she's able to tell the parts of her own body.
She
Hello.
is able to tell the.
Yeah.
Hello, ma'am.
Huh. She's able to tell the parts of her body.
She is able to tell the parts, ma'am, but right, left, like that confusing, ma'am. She is getting. She is unable to tell right, left
No, no, I am not understood.
correctly.
That is right, left. It's totally different comprehension testing. No, different lobe only. Right,
Naming
left.
correct only, ma'am. Name.
So you have told 1 out of 3. What all things you gave her for naming?
AC remote, ma'am.
Hmm.
Hello, ma'am.
That is not her day-to-day life objects,
One
suppose, for
body part.
example. Hmm.
Okay, ma'am.
Body part.
Body part I asked for eyes, ma'am.
That she was able to show.
Yes, ma'am. She is able to show.
Correct. Then did you give her any other thing? Hmm?
I asked for the fan
Like
and
a pen,
ice and
pen and all,
AC
pen,
bottle.
pen. Pen she was not able to name.
She is able to name, ma'am, pen.
I'm really doubtful whether there is a naming issue. Okay.
For actually animals, also she didn't correctly name, like buffalo, duck, hen. Also she unable to name, ma'am.
She was able to
Pen
recognize
she
them, or she was searching in the book like this, turning her head. Was
no,
she
ma'am.
able to
She is not
understand?
searching. She is naming other animal name, ma'am.
So what do you
Rather
mean
than
by
buffalo.
this? Is there a language involvement in her? Is this an aphasia?
Because I thought by seeing knee hammer, she told, give me that pen, ma'am. And seeing the AC remote, she called it phone. Her asked her husband to take your phone.
So
So
correct.
I
So
thought,
then you can say that there could be, but is it still difficult to understand whether it is a visual agnosia or whether it is a, see, if somebody is not able to name, what all possibilities will be there?
one visual agnosia, ma'am.
Okay.
The semantic memory involvement.
They see it can start off from the language issue, it can go to visual agnosia. Okay. So language
Okay,
issue
ma'am.
means what? Anomia.
Okay,
Huh?
ma'am.
Or it can be a semantic aphasia.
Yes, ma'am.
Or third, it could be a visual agnosia.
Okay, ma'am.
Suppose, for example, these three differentials are there. Hmm?
Yes, ma'am.
Now, how will you differentiate each of them? Suppose she's telling that that TV remote as mobile, I think.
Yes, ma'am.
Huh.
Yes, ma'am.
So then how will you differentiate that this is not a visual agnosia, this could be a language issue?
We can ask for what purpose it is being
You
used.
have to check it in other modality. You have to check it in other modality.
Okay, okay, ma'am.
So visual agnosia versus semantic, you give it in her hand,
Touch.
she identifies it and tells the use also. It is automatically visual agnosia because
Visual
she could
agnosis.
identify it in other modality.
Okay, ma'am.
Understand? If you
Yes,
give
ma'am.
it in her hand and still not able to answer, then what it could be? She's not able to tell the
Semantic.
use also and she's not able to tell the name also.
Semantic aphasia.
Then it is semantic. But she is
Yes,
able
ma'am.
to tell the use but not able to tell the name. Then it becomes anomic aphasia.
Visual. Anomic.
Visual why? See, if you are able to identify something in different modality other than visual, that means there is a visual agnosia.
Visual agnosia.
Understand? But in other
Yes, ma'am.
modality also, she's not able to tell the name also and use also. Then it is a semantic. She's
Semantic.
able to tell the use but not able to tell the name. It is
Name
anomia.
only name.
So in your case, I need to understand ki whether it is an anomia or semantic or you have to check basically. Okay.
Okay, ma'am.
Then next.
Recent memory impaired, ma'am. I asked what she had for the breakfast, how she had came to the hospital, how she reached.
Hmm.
That
See,
she
in
is
the memory also, you divide it like you can start off with the working memory. You give the phone numbers
for
and all they have to
for
repeat.
okay, ma'am.
Okay. And then you go for the recent memory. In recent memory, again, you can do 3 minute, 5 minute, 7 minute recall.
Okay, ma'am.
Then you
Ma'am,
can give them address recall.
okay, ma'am.
Okay. Then you have to give them story recall.
As I had given ma'am story recall also, I divided into recent memory, remote, new learning. In new learning, paired, associated, unrelated, verbal story, and visual memory. Recent memory,
No. See. That's what I'm saying. That paired associative memory and all, that is not a new learning kind of memory. You just
okay,
differentiate it like what I told. You can say that working memory in the recent memory, you can whatever I told. Then
Okay, ma'am.
so in that you have address recall, you have story recall, your 3 minute, 5 minute, 7 minute recall.
Okay, ma'am.
Then after that, you can ask for you can check for paired associative memory.
Okay, ma'am.
And in that unrelated and related words.
Okay, ma'am.
And then you go to verbal memory, then you have topographical memory, you have landmark identification. You have done that?
Landmark identification, topographical, I didn't.
Because visual memory, how did you check?
Visual memory, I had given 5 objects and I hidden them in front of her, ma'am. And after telling the story, I asked where I had placed this object.
Okay.
Hello,
So
ma'am.
can you tell me,
Yes,
most of the dementias or conditions usually have recent memory more than remote memory impairment.
yes, ma'am. Yes, ma'am.
In which condition you have remote more than recent involvement? Remote memory loss more than recent memory loss. It's Wernicke-Korsakoff's.
Okay.
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 And in this, in the memory, one we forgot is that semantic memory also. You have to check that remote you have written now. That is actually semantic memory. In the
I
semantic, you have
asked.
to ask. See,
Okay.
in the semantic, you have to ask where is the Taj Mahal situated and all that. Okay, where is her home, native place? Where is her school? What is the name of her school? All that. That is semantic memory. Okay. So one is
Okay, ma'am.
historical and another one is autobiographical.
Okay, ma'am.
Okay, so that way we can differentiate. Whatever the way you are checking is also fine, but then you have to do more. Okay, because we are talking about memory issues over here in this case.
Okay, ma'am.
Hmm?
Okay, ma'am.
What are the causes of amnestic syndrome?
Alzheimer's disease, infections like HSV, autoimmune like LGI1,
More commonly,
strokes,
which
strategic
stroke?
strokes, strategic infarcts.
No. You have to say hippocampal strokes,
Okay, ma'am. Okay.
which is PCA territory stroke.
Yes, ma'am.
Head injury.
Head injury, temporal lobe involvement. Yes, ma'am.
Wernicke's also. Wernicke's encephalopathy.
Okay, ma'am.
Okay. Then next. In this patient, the temporal lobe is worse.
Yes, ma'am.
Yeah. Then
In parietal lobe, pantomimes and imitations, gesture knowledge normal, ma'am. Sequential actions are also normal, ma'am. Limb kinetic also she is able to do.
If somebody is not able to do an activity in sequence, that is what is called a sequential loss, and that is praxis impairment.
Yes, ma'am.
So, how do you differentiate that from executive dysfunction?
In executive dysfunction, even one task,
No.
At every step they will do errors,
What
ma'am.
kind
Rather
of
than
what kind of praxis it is when you have sequential task impairment?
idea mode,
No. Ideational, no?
ideational, ideational, ma'am.
Yeah, so individual portion, independent action can be carried out in ideational versus executive. But also about the tool selection. I think they're not able to select the tool properly in the ideational.
Yes.
Okay.
In
So the parietal lobe is okay that way.
uh, construction,
That will be
she
conceptual, I think. Conceptual mein tool selection is lost. Ideational mein tool selection is preserved. That's the difference. Then
for construction, I asked her to wear rangoli, ma'am. Previously, she used to wear 10 dots rangoli, 10 to 1 dot. That she is unable to do now. But simple, she is able to do 5 dots. Previously, she used to do this, ma'am, but now she is unable to do.
okay. What does this mean?
More complex construction, she is unable to do. Construction also involved, ma'am.
You meant to say constructional apraxia is there.
Here, they had to circle.
Any other did you give examples? Because your clock drawing was like there was no drawing issue. Any other you have given to draw?
Tube. Tube.
No,
I
not
had
this. Regularly, what all things we give for checking the construction?
flower pot.
Yeah, where is that? Because that should be for her education level, that should be good.
Okay, ma'am. But actually, ma'am, one doubt. Previously, she used to do this task now, ma'am. Now she is unable to do. Might be attention or executive dysfunction.
But in this, what errors have happened? Which was the previous one?
Ma'am, previously she used to do with 10 dots, ma'am. This is bigger rangoli. This is only 5 dots, ma'am.
Acha, okay, okay. Okay.
That's what I'm asking. Because bigger
Fine.
rangoli she is unable to do, but smaller
5
rangoli she
dots
is.
she's able to do. Attention it is. She's
Okay.
losing attention, no? After 5 dots, the attention is lost.
Okay, ma'am. Okay.
Okay.
For clock drawing, without seeing this, ma'am, on copying, with seeing, she did like this.
It's okay.
Labeling,
But still
number
the
errors, ma'am.
number are still wrong only.
Numbers. Yes, ma'am.
What is reverse clock?
Ma'am,
Reverse clock.
reverse clock. Don't,
What is reverse clock sign and seen in which condition?
don't know.
It is seen in Alzheimer's, no? So you are drawing this 12, 1, 3, 2, 3, 4, 5, 6 like that, clockwise. They're doing it in anti-clockwise.
Okay, ma'am.
Okay. Somebody asked this difference between, see, sequential actions can be impaired in both the things, in executive function as well as in ideational apraxia. Okay, the sequence,
Okay.
mis-sequencing of the steps can happen in both the conditions. Okay, but in ideational apraxia, tool knowledge is impaired. Okay.
Conceptual.
No, that was not conceptual. I also checked it again.
Okay.
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 So difficulty in sequencing that can be there in ideational also, but tool knowledge is lost in ideational apraxia. Tool knowledge. Okay.
Okay.
We have to inform before placing the objects in testing the visual memory. Okay. We have to tell them this is the, we have to ask them to name. How do you check for visual memory? You have to ask them to name these objects. Then you are keeping all of those objects and telling them that we are hiding them over here, this, that. Then you have to divert them. And then after some time, you have to again ask them. They have to tell the
Okay,
name also correctly, and they have to tell where they are hidden also correctly.
okay, ma'am.
Okay?
Okay, ma'am.
Yeah. Then
Visual feels normal, ma'am. Color vision normal. Faces recognition, I given idols, gods. Hello, ma'am. God idol faces and Mahatma Gandhi. These I have given, ma'am. She is able to do that. Say, cinema
visual memory is a function of which lobe?
visual is right side, madam.
Yeah, right temporal lobe.
Yes, ma'am.
Yeah. Okay. So I don't think that objects naming, I don't know where it is coming. It is coming in the visual object that you have to check yourself. We are not able to tell that. Because naming part is still confusing, whether it is visual agnosia part or is it because of the language issues that we are not able to tell.
After taking the mobile and seeing, she is able to tell that it's not. I mean, she's seeing the AC remote I had given to her hand, ma'am. Then she is able to tell it's not the mobile, but I don't.
Then it becomes a visual agnosia.
But the other tests related to visual agnosia, she is not doing,
It
ma'am. I
might
asked.
be. It might be.
Okay, ma'am. Okay, ma'am.
They could be having simultaneous visual attention impairment is also there, no? That
Yes, ma'am.
Rangoli
Yes, ma'am.
drawing, visual attention
Yes,
is also not good. It could
yes,
be a
ma'am.
simultagnosia. Who knows? We have to check it properly.
Okay, ma'am.
It could be a PC variant. Your age is also quite a little earlier, like say 65, 62 she is, na?
65 years old.
Acha, she's 65. Okay, okay. But still, she could be a PCA variant. Or she might have developed the posterior circuits involvement that we need to do check properly actually.
But going to the milkman and going to the
That will
shop,
come late. That will come late. That
okay,
will
ma'am.
come late.
Okay,
Okay.
ma'am.
It
Okay.
will first come in the here in the taking the examination. No,
Okay, ma'am.
she is hardly going outside. Okay. So and these are all familial places. Familial places, visual spatial goes last.
Okay, ma'am.
Hmm. Okay. So from your final this thing, what is your summary? And there are no
65 years.
Parkinsonian features or anything, no? No pyramidal or Parkinsonian
No,
features.
ma'am. No, ma'am.
Okay.
Only the positive thing is palmomental in frontal release side, palmomental left side positive, ma'am.
Okay. So
65 years old female, hypertensive, diabetic, hypothyroid on regular treatment. But hypertension is not well controlled, presented with cognitive deficits involving attention, working memory,
apathy,
exu-
why apathy came here? After your examination, she has cooperated, no, for most of the
yes,
things
ma'am.
she has
Yes, ma'am.
done. And I mean, I don't know whether to put apathy here or not, but there is
Okay,
an
ma'am.
attention issue gross, which means dorsolateral prefrontal,
Yes, ma'am.
episodic and procedural is lost. So again, it is like medial temporal maximal involvement
Okay, ma'am.
and parietal. I
Construction and calculation, I think.
see this may or may not be involved. We don't know. There is
Okay.
so much of attention issue. Okay.
Okay, ma'am. Okay.
Hmm.
Ma'am, but her anger issues are very high. Before also I tried to tell
The
ma'am that.
anger can happen in depression, but it's not frontal lobe release
Okay, ma'am.
feature.
Okay, ma'am.
Is she using foul words? Is
No,
it
ma'am.
something
No
which is
foul
very
words. Just she is shouting
huh.
that.
So is it like see when you want to label it in under frontal lobe dementia, there has to be little features of
Period.
that.
Yes,
Okay.
ma'am.
So anger becomes so extreme that they start using foul words which they never used before. Or anger becomes so much they start beating up the small children which they never did before. That becomes really frontal lobe related.
But for I told that misplacing objects, all this. For that, she is scolding her daughter-in-law and
Holding.
grandchild and
Hmm.
that they had taken and asking them to not enter into her house and into the room.
Okay.
That's why I thought
No, but from that one history, you can't really put her into
It is
direct
going
improvement.
on from almost.
No, but that
from.
is still one history. One history. I'm
Yes,
saying.
ma'am. Yes, ma'am. Okay.
Okay, it's not fulfilling the diagnostic criteria.
Yes, ma'am.
So, what possibilities will you there now?
Alzheimer's disease first possibility, ma'am.
Or mixed, I would say, because of the
Or
vascular
mixed
risk factors.
vascular cognitive
Yeah.
impairment.
Abhi frontotemporal we can keep third after all the examination because
Okay.
lot of scoring impairment and everything was there.
Okay.
But then again, from the history point of view, it doesn't fulfill the FTD.
Okay.
Or you have to take more history now.
Okay,
Yeah.
ma'am.
So, what is the MRI showing?
This is her MRI, ma'am.
There's nothing vascular here.
No vascular pathology.
But there's
Only
not much atrophy also here.
here anterior temporal.
Yeah, left anterior temporal. So there could be that, I don't know, you need to have a coronal section. On axial sections, still it is seen actually left anterior anterolateral temporal. But you have
When
not checked the vital things, no. That is why we are not able to conclude. Language you have not checked properly.
Okay, ma'am.
This type of left anterior, this type of atrophy, you can see it in semantic dementia.
In semantic way. Yes, ma'am.
Yeah, but then you have not checked the language properly. There is no single word comprehension testing. Naming, we are not able to tell 100% when naming is impaired or visual agnosia is there. You have to check the language components properly.
Okay, ma'am.
Frontal, I'm not sure atrophy is there or not here. We need a coronal section of it.
Okay, ma'am.
Sir, Dr. Varun?
Like what specific MRI sequences would you like to do for like mixed dementia?
Hello, sir.
What specific sequence of MRI like would you like to do for like mixed dementia? For
Claire.
example, like Claire will show white matter hyperintensity, strategic impact. So what else? Like which sequences would you like to do in MRI? Other example is like SWS sequence will show microbleeds. So when there is
As
lobar microbleed, there will be
as
like possibility of
cerebral amyloid angiopathy.
and when there is deep microbleed, there is hypertension induced, like encephal, like hypertension induced. So like you can do like a 3D T1 volumetry for hippocampal atrophy, isolation modeling. Like that these questions you can expect from an examiner when the management and investigation part is asked.
Very good.
The voice is breaking, sir.
In your approach, first of all, in your approach, history taking happened, but it was not too much, like there is nothing deep history taking. If somebody has a language complaint, they will start off with that. They are not able to name the objects
Yes,
at
ma'am.
home, or if they are asked to bring water, glass of water, they will bring some other utensil, something like that. They will start noticing at home, and then the things come to you. Okay, or if she was reading before some religious book she used to read before, now she's not reading it correctly, or that history you can ask. So history is needed, plus the examination part is also inadequate. Okay, especially the language part.
Okay, ma'am.
Okay, you need to go back and recheck her.
Yes.
Maybe give a follow-up. Okay,
Okay,
whatever
ma'am.
we discussed.
Okay, ma'am.
Basically, like what management and what investigation will you do? Like what else? Like history after history taking it, like what else in management and investigation would you like to do if you are in a very advanced sector?
PET scan. Hello, sir.
Yes, yes. Tell me. Like you just tell me what we will do and like what will you find it in it.
Okay, sir.
Like suppose you are doing a PET scan. Like what for what you are doing that PET scan?
To localize the lesions means where the actual hypometabolism mainly specifically to particular regions, we will get the information whether it is particularly involving only frontal, temporal, or specific regions. By
So
that we
the
can.
answer, yeah, the answer should be like that. Like investigations, your approach will be there. So basically, you will go for some blood investigations, then you will go for imaging, and there will be functional imaging, then advanced imaging, then
Okay, sir. Okay, sir.
CSF related testing. So like initially, examiner's approach will be different. Like some examiners will prefer like you need to tell about some treatable causes of dementia first, and then like we can go for neurodegenerative, though the history is of neurodegenerative disease. So like what the different in blood investigation, so for this particular case, like what CSF things like will you go, like not available everywhere, but like what CSF biomarkers you get, like you can think of.
To rule out Alzheimer's, A beta 42 by A beta 40 ratios.
A beta 42, like what it will be reduce, increase, or it
Decrease
will be
its A
same.
beta, okay, sir. A beta 42 by A beta 40 will be reduced in the CSF, sir, in
What
Alzheimer's disease.
and what else, like what other things? Tau, phospho-tau,
CSF
can you do?
tau.
Yes. So like you should read about that also. Like if some examiners are like they are more into recent advances, they might
Okay,
ask that. Okay. And
okay,
like
sir.
something you should know about, like what is the latest monoclonal antibodies available. You have any idea about that?
Yes, sir.
Hmm?
I don't know.
In Alzheimer's disease, for Alzheimer's disease, you are asking.
Yes, 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 yes. You just go and check about those antibodies
Okay,
where
sir.
they are
Okay,
affecting.
sir.
Okay. So where it is like and what are the newer advances. Okay.
Okay, sir.
Can you just so like in FDA recently 2023, anti-A beta protofibril monoclonal antibody was like lecanemab was like FDA approved. And another thing like this, can you just tell me like some reversible causes of dementia? Just enumerate.
Subdural hemorrhage. Hello, sir.
Huh?
Subdural hemorrhage, B12
Yes, one.
deficiency,
Yes,
hypothyroidism.
correct. Then see, reversible causes, many causes are there. So you should make a list and it should be like on the tip of your tongue, like hypothyroid, B12 deficient, drug induced alcohol related, and pH like that. Okay.
Okay, sir. Okay, sir.
So like you should, that should be on the tip of your tongue. Okay. Fine, fine.
Okay, sir.
Okay. Thank you. Thank you.
Okay. See, basically, examination needs to be a little more deep, especially with the language. If you are uttering the language as a prominent component, or if it is there or not there from history or examination, at least it should be clear. Because
Okay,
when
ma'am.
you are not able to name something, it has lot of differentials. Okay.
Okay, ma'am.
And
Okay,
if
ma'am.
you show this image just like this in the actual, it may look a little left side, but it's too difficult to comment like that. So you have to have coronal images for this.
Okay, ma'am. Okay, ma'am.
But forget about MRI. Some examiners may not like the MRI and all other investigation
Yes,
or
ma'am.
something
Yes.
like that also may happen. So you need to have an approach to your own case. Okay. And you should be
Okay,
able
ma'am.
to come to a conclusion first, second, and third, at least this much. And you have to
Okay, ma'am.
tell the for and against for each.
Okay, ma'am.
Okay. From your history and examination, both it should match.
Okay, ma'am.
Okay. From your history and examination, what matched was there was a episodic memory impairment.
Okay, ma'am.
And what also matched was attention impairment.
Yes, ma'am.
Okay. So these two things matched. There was frontal and there was temporal lobe involvement. That doesn't mean it became FTD. The clinical
Yes,
criteria
ma'am.
has to fulfill.
Okay, ma'am.
Okay. So
Okay.
clinical criteria is your those behavioral variant FTD criteria or semantic variant FTD criteria. Something has to fulfill over there. It's not
Okay, ma'am.
fulfilling. So I would say that this could be an AD or a mixed dementia because we don't know the MRI. Okay. Looking at the
Okay.
MRI and going back on the diagnosis and changing your differential should not ever happen.
Okay, ma'am.
Okay?
Okay, ma'am.
Because
Okay.
examiners come to know that you have seen all the investigations.
Okay, ma'am.
And some examiners may not like it at all.
Okay,
Okay?
ma'am.
So you tell your clinical differentials. That's
Okay,
it.
ma'am. Okay, ma'am.
Okay, so from your examination, we could see a lot of memory issues were there, etc. History wise, also it matches, so we'll say it could be an Alzheimer. That is the
Okay,
most
ma'am.
common. Also, what and you should know the differential. What are the rapidly progressive dementias? Okay,
Okay, ma'am. Okay, ma'am.
causes of rapidly progressive dementias, which is then what are the differentials of rapidly progressive dementias? What are reversible dementias? As sir
Okay,
said.
ma'am.
Okay, all of this you should know the differentials.
And you should
Okay.
know about circuits, the latest salience
Yeah.
network and all networks also, and Pepe's circuit perforant pathway. Like
Yeah.
it goes into neuroanatomy then and physiology. You should know that also.
Okay,
Hmm.
sir.
Okay, I think this was good enough.
Thank you, Jit.
Ma'am,
Thank
thank
you.
you.
Thank you.
So, anybody have any question they can ask? One.
See, that's what I said. Somebody has asked if typical AD should involve temporal and parietal, and here it is frontal. That's what I said. You have to go by clinical. You can't be like based on MRI. You can't go back and diagnose a dementia. If patient turns head to decipher, I was asking because patients who have simultagnosia or visual inattention, they have a searching head movements. When they are looking at a page or when looking at an object, they have a searching head movement. They have patches of vision. So they try to move her head and they try to identify that object. So that's what I meant, whether she had head movements on identifying. And I think one more thing is that examination protocol. How much time did you take this examination?
Complete with history and examination, 1.5 hours, ma'am.
1.5 hour you finished?
This is OPKS, ma'am. Actually, I haven't taken recently, ma'am. It
Hmm.
is. Mm.
So basically, you have to memorize your examination points
Okay, ma'am.
because most of the examiner they don't allow you to carry all those things. No.
Okay, ma'am.
So you have to have your points ready. Like how are you going to go and which sequence you are going to go? You are going to
Okay,
take
ma'am.
a check attention, then you are going to go to MMSC testing, then FAB testing, then from that you will go to frontal lobe assessment, temporal lobe. In temporal lobe, what all things you are going to ask? That has to be
Ma'am,
fixed.
one doubt, is it mandatory to mention MMSC, MOCA and FAB if we are doing lobar
No,
for?
that's what I'm saying. It is
Okay,
not
ma'am.
necessary. So what we over here we used to do is MMSC. You do attention checking, you go for MMSC.
Okay, ma'am.
Attention we always check first.
Okay, ma'am.
Okay,
Okay.
then we go for MMSC, MMSC
Okay,
to
ma'am.
FAB,
Okay, ma'am.
and from there onwards we go for frontal lobe assessment.
Okay, ma'am.
Okay.
Mm.
Again, somebody has asked, ma'am, your patient has frontal and temporal involvement clinically. This does not, that's what a history, there is no frontal lobe involvement. Behavioral variant
Yes, ma'am.
FTD ka, there is no history only. There is no social disinhibition, there is no lack of empathy, sympathy, and there is no lack of
Only one
interpersonal
point
warmth.
is there. One point.
Only one point is there. We cannot say that there is a behavioral variant FTD here.
Okay, ma'am.
Okay. Or you have to take, see, either you have to take more history to fit it into FTD. Don't go by MRI.
Okay, ma'am.
Okay. Or you have to do proper
And still
examination for
now
the,
also she is able to socialize. She is able to do
yeah.
cooking, ma'am.
No, so that's what I'm saying. So you can't really say just based on the MRI, it looks something like thoda sa temporal
Okay,
lobe
ma'am.
involvement.
Okay,
So
ma'am.
to say it is FTD, no. You go by
Okay.
your clinical stuff.
Only clinical.
And in that attention was grossly impaired. So it is very
Yes, ma'am.
difficult to judge whether it is FTD. It is very difficult to judge whether other lobes were all really involved or because of attention issue they were involved.
Okay.
Okay. MMSC and MOCA are paid whether to use or on board means.
Copyright issue.
MMSC you can do. I think that's it, no sir.
Yeah.
Free to
Yeah.
use, na?
Yeah.
Of the case. Okay, if there are no further questions, we can conclude. And
Yeah.
thank you,
Yes.
Dr. Soleha
Yeah.
Madam and Varun sir,
Thank you.
for
Thank you.
moderating this session. And thank you, Dr. Deepti, for presenting. And thank you, everyone, for attending this session.
Thank you. Thank you.
We will conclude.
Thank you, sir. Thank you.
Okay.
Okay.